We are joined right now by Paul Keckley. He is Executive Director for the Deloitte Center for Health Solutions, and he is with me now right here off of Capitol Hill. Paul, welcome. We're so glad to have you on the program.
Thank you.
I want to ask you, before we talk about the trade groups, has the CBO been gamed? I mean, there's a lot of strange timing issues, some critics say. I'm just wondering where you weigh in on that.
Well, I read the March 20 letter to Ms. Pelosi that was appropriately called the preliminary analysis by the CBO. So I don't think gamed. I think it stayed within the constraints of its charge, which is to give its best judgment, and I think it's not precisely accurate. I think it may be directionally accurate, but not gamed.
What about worries about inflation? How inflationary is this bill going to be?
Hard to say, because they've forecasted now for the next 10 years health costs will increase at 6.2%. So does this account for inflation? Yes. Does it account for a level of inflation that we would see coming out of a recovered economy? No one knows for sure. So I think what you have right now is an educated guess. I think the fact the CBO came out a day or two before the vote last night to say it could have a $138 billion deficit reduction impact gave some members some assurance that they wouldn't be hammered in the fall. But I've studied it closely. I don't know how you can be precise at this point.
We can be precise, though, or at least take a very educated guess about how this bill is going to affect certain industries.
Yeah.
If you look at the one that's going to be affected for the best and the one that's going to be affected for the worst, what are those two extremes?
Well, the most disruptive probably is the insurance industry, because you have a compounded effect of a lot of new regulations that are both federal and state. You have cuts in their Medicare Part C Advantage plans, and you have new industry taxes. So that seems to be a fairly hard-hit sector. But others are, equally hurt in some ways. There are new taxes in medical devices and pharmaceutical industry. The hospitals have to really change the way they operate. Integrating with physicians, they have to align around being paid by value, not by volume. And then there are Medicare cuts that really decelerate their revenue, their top line.
Who has helped the most, aside from, in theory, U.S. citizens? Well,
healthcare information technology companies for sure have a real wind behind their back, because in the stimulus package there's $20 billion for everyone to adopt electronic health records. You would think that the pharmaceutical industry on balance did pretty well through this. The cut in the donut hole is offset by new people that are insured, and 12 years of exclusivity on some of their patents. So I think they're okay.
Paul, you're a Washington insider. What do you think happens in the Senate?
I suspect that the reconciliation bill will pass. I think it's going to be a very difficult few days for some negotiations, and but we expect that to be the case.
All right, Paul, thanks so much for your time, for stopping by. Paul Keckley, Executive Director at the Deloitte Center for Health Solutions.